Michelle Young. I'm a respiratory therapist and an ECMO specialist at Massachusetts General Hospital. I am going to explain about ECMO as we take care of your loved one. Your loved one's heart and/or lungs are having trouble. The heart is unable to pump blood to the lungs, or their lungs are too sick to pick up oxygen and deliver healthy oxygenated blood to nourish all of the vital organs. Your loved one is on medication and a mechanical ventilator to help with this. When these interventions are not enough, then we need to add ECMO for help. ECMO stands for extracorporeal membrane oxygenation. It's an advanced life support when the heart and lungs are failing and all other modes of therapy cannot provide enough support. Patients who need ECMO are on the machine 24 hours a day. Large IV tubes called cannulas are placed into a vein and/or an artery. The cannulas help deliver blood from the patient's body to the ECMO machine and back into the patient. The ECMO machine warms the blood to body temperature. Then the well-oxygenated blood is pumped back into the heart and delivered to all the important organs. The oxygenator membrane that the blood travels through will help oxygenate and ventilate the blood. The type of ECMO your loved one has will depend on what problem is present. Your loved one could have respiratory problems or heart problems or both. Veno-arterial ECMO supports both the heart and lungs. VV ECMO, veno-venous ECMO supports the lungs. There is a risk of bleeding. Your loved one will be on blood thinners for the ECMO machine to work best. The blood levels are followed very closely, but sometimes bleeding could occur. If this happens, your loved one will get blood or platelet transfusion to stop the bleeding. There is always a risk of infection with any lines and tubes in the body. Your loved one will be on antibiotics to prevent infections. ECMO is not a cure or a treatment. ECMO provides support to all of the vital organs while the heart and lungs rest and recover. The medical team will determine if the patient has improved or if there is no change. The surgeons will remove the cannulas in the ICU or in the operating room. The patient will probably continue to require the mechanical ventilator to help with breathing. I hope this video was helpful to explain what ECMO is. If you have any questions, please reach out to your medical care team.